7 unions in the healthcare sector have issued a 2-week strike notice. The healthcare workers, among them doctors, nurses and clinicians, want 40 counties to pay their salaries on time, restore medical cover and remit their statutory deductions in the next 14 days or face a combined strike that will likely ground health services in the affected counties. Brenda Wanga reports on the impending strike.
3 months after the country was treated to a 59-day-long doctors and even longer clinical officers strike, millions of Kenyans could be staring at yet another strike in the sector, and this time round, it promises to be wider in scope.
That all the health workers, that is the nurses, the doctors, the clinical officers, the lab technicians, the morticians, and everyone, and the public health officers will be out of work as they demand for the justice to be implemented, as they demand for these things to be implemented, as they demand for their monies that are illegally withheld to be released. This is the notice that we have given today, and we ask the counties to wake up and be accountable on this immediately.
Sasa mgomo lazima ifanyike, tunataka tuheshimike.
The union say the counties have failed to honor their obligations towards their members.
That we want the salaries to be paid on time so that the health workers are facilitated to be in the hospital. That we want the medical insurance to be provided for healthcare workers to get the care that they need. That we want that the money that has been deducted in the payroll of the health workers to be remitted in the respective institutions. That's all.
The healthcare workers particularly decried the delay of payment of salaries, with some counties failing to pay salaries for 3 consecutive months, leaving their members in financial straits. The lack of provision of medical cover, even after the KMPDU agreed to give counties a 90-day period after the signing of the return to work formula, is also a point of concern to the workers.
Health workers are human beings who have bills to pay. And being a nurse or being a doctor or being a clinical officer will not fuel your car at a petrol station if your employer has refused to pay you on time.
What we are asking is not that we are asking for a favor from the employer. Whatsoever we are tunapoamuka kila siku kufanya kazi, tuko na jukumu, we have a right to be paid equally for whatever we do.
Failure to remit the deductions also has the healthcare workers worried.
Na pia kukata pesa ambayo inahusiana na NHF na hujapeleka, nikienda hospitali ninanyimwa kupewa huduma. Nikienda na mtoto wangu anaumwa ninanyimwa huduma kwa sababu hujalipa, lakini umeshakata kutoka kwa payslip yangu na mshahara wangu.
The unions have also accused the county government of failing to prioritize healthcare workers' welfare, leaving them demoralized. Unlike the doctors' strike that lasted for about 3 months and that was nationwide in scope, the healthcare sector workers say this looming one will focus on individual counties that are yet to do their part in fulfilling the return to work formula and the CBA agreement. And they say that this time round they will not be backing down in asking that their demands are met. Brenda Wanga, Citizen TV, Nairobi.